assigned, our patient's name was Martha. We certainly would have not chosen to name our borderline personality disorder patient after a beloved professor. So we all wish her well. We love you, Martha. You're in all of our thoughts. So again, we're fixing incidental, blah, blah, blah. And please don't think we're making light of a serious condition. This is just meant to entertain while we inform. And now it is my pleasure to present to you for the first time on stage, Oh Borderline, the musical. So apologies to none of Mr. Singers. Ring. Hello?
It's Martha.
Yes, Martha.
Hello. It's Martha.
I know.
I'm calling now to tell you something. I took a bunch of pills this morning. I decided that it's time to go.
Fine. I'll summon you an ambulance. But Martha, we've been through all this before. You put me on a pedestal and harmed yourself in ways so dreadful. My new wife's called Dead Soup with your little whore. You trapped me with your hurtful, awful lies. Swore you'd kill yourself if I were to ever leave. It took 2 years for me to find the strength to leave you far behind.
We're perfect for each other, I believe. You're the only one who ever understood me. Without you, I truly am alone. The only one who ever cared can help me now. My life be spared.
Martha, I'm hanging up the phone.
But Sam, I want you to really hear me. It's important that you...
Click.
Hello? Sam? Hello? I'm nuts.
So to the casual observer, it might seem that I am very unsympathetic. But you see, I've been dealing with this for a long time. Martha deceived me, told me she was pregnant, so we got married. We remained married for 2 tumultuous years. One day, I would be the most perfect man she'd ever met. And the very next day, I would be Satan himself. When I finally decided I could no longer handle the emotional roller coaster, I divorced Martha. I'm since happily remarried with 2 wonderful kids. However, in times of crisis, Martha still calls me. And because I still care, I respond each time. I met Martha at the hospital this afternoon, and had an opportunity to speak with the nurse. I'm hopeful that hospitalization will allow Martha to get the treatment she so desperately needs. I think she's about to meet with the nurse. Let's take a look.
Hello, Miss Blank.
You can just call me Martha.
Hello, Martha. My name is Kathleen, and I'm going to be your nurse. How are you feeling?
I don't really feel like talking to you.
Okay. Well, if you don't mind, I'm just going to sit here for a little while, and if you feel like talking, please do. I'd be glad to listen.
I'm bored.
Can you tell me more about that?
Well, I'm lonely, I'm bored, and I'm nothing without Sam. I don't even know what there is to live for since he won't love me.
How have you been able to cope with this in the past?
Well, sometimes I've seen this therapist guy, but it doesn't really help, so I don't go very much. And then, sometimes I do things to try to make myself feel.
What sorts of things do you do to make yourself feel?
Well, like sometimes I've cut myself, and one time I burned myself. But I still just feel empty, even when I do those things.
That must be really difficult. Are there any things in life that you do enjoy? Do you have a job?
No, I'm so awful I can't even keep a job. I quit college right before I was about to graduate. I'm just so stupid. I don't want to talk anymore.
Okay. Well, maybe a bit later you might want to talk, though. Is it all right if I come back?
Yeah, that sounds good. But I don't want to talk to
good nurse, just like the rest. I'm a good nurse. We're all the best.
Okay, well, I don't want to talk right now. I just want to be alone.
All right, well, I will check back in about 15 minutes then.
Okay, the nurse has found a few minutes now in her busy day to do some charting and prepare a plan of care for Martha. She's been given a lot to consider, so let's take a peek into her process.
Now, Martha, let's see. I have to have Dr. Brown look over her current medications and let me know how he'd like to proceed. Her vitals were all within normal range today, but what is really stumping me is how to diagnose her. There is so much to consider here. A risk for suicide, self-mutilation, ineffective coping, social isolation. She's exhibiting a great deal of low self-esteem. Out here on the borderline, it isn't very hard to find a diagnosis. I'm worried for my patients, stressing bring on transient. Psychosis. Without a proper plan in place, she's surely now at risk to face a poor prognosis. I do not think she's coping well. She's told the world to go to hell. Come on, you know this. So what is my priority? How can I serve her best? What is my priority? Find it now, then worry about the rest. Think of Pharaoh Maslow and his pyramid. The basement layers food and poop and breath. Her vitals check, she's got a bed. The problem is all in her head. So what now upstairs just might cause her death. What is my priority?
How can she serve me best?
What is my priority? Find it now, then worry about the rest.
So there you have it. As our nurse so astutely noted, it isn't hard to come up with several nursing diagnoses for this patient, but as she asked, what's her priority? Anybody got any guesses? Anything you're thinking of? Come on, somebody.
Risk for self-harm.
Risk for self-harm, that's a very good one. Now, we toyed with the idea of risk for suicide, because clearly she is at risk for suicide. But as we had drilled into our heads, a risk diagnosis should never be your priority diagnosis. So, what does that stem from? What does her risk for suicide or risk for self-harm? Impaired coping. Exactly. Here, I've got a button for you. Congratulations. You have mastered this concept and have no room for improvement. We chose ineffective coping related to personality disorder as evidenced by suicide attempt, self-mutilation, and feelings of worthlessness without her ex-husband. And we figured if you were to work on her coping skills, you would have a lowered risk for suicide, lower risk for self-harm, PTSD, self-directed violence. There's all kinds of stuff that kind of flows from her impaired coping. So, ladies, you want to add anything?
No?
I would just love to thank my teammates for sacrificing their dignity with me. I should never have asked anyone to do this, but thank you all. And if your presentation requires a PowerPoint, just get it onto the computer and then signal the woman upstairs, Sam, was it? Sam, and she will help you out. Get the overhead projector on. Thank you.
Encore!